When you get your hearing test results, it's very easy to just nod along, take all the information and leave with half of it not quite landing. So here are some ways in which you can work out and ask before you walk out, because it's your hearing and you're allowed to understand it. So firstly, ask what your results actually mean in plain terms, not just a number, but what it means for how you hear. Ask whether it's normal for your age, because some change is expected and some isn't. Ask which sounds you're missing and whether it's one ear or both. Ask whether it's likely to stay the same or change over time, and whether there's anything you should keep an eye out on. Ask also what your options are, even if you're not ready to do anything about it yet. None of these are silly questions. A good clinician would much rather you ask than leave confused. And once you actually understand your own results, everything after that gets easier.